changing the way we think and how we live our lives is one step in the right direction. Welcome back to Be Well Berkshires. I'm your host Jim Willis. I am the administrator of the Be Well Berkshires Community Initiatives. Be Well Berkshires is a mass emotion initiative that is designed to promote policies and programs to foster a healthier lifestyle. What does that mean? Well, it means that we want you to eat better, move more, and be well. The format of this show is to speak with community members on what's going on in our community regarding health and wellness activities and to bring that information to you. I want to welcome our guest today, Marge Cole from Berkshire Health System's Care Navigation Program and the Women's Imaging, and Ellen Croibier from the Look Good, Feel Better program. Welcome to the Be Well Berkshire show. So October was National Breast Cancer Awareness Month, and obviously we're now into November, so we had some scheduling conflicts, but nonetheless, this is a very important topic to many of us. Cancer in any type of form has hit us. Well, family members, friends, neighbors, and part of the Be Well Berkshire show is to talk about physical activity and healthy eating, but really to bring what's going on in the community to our members to know what resources are out there, what's going on, and really about prevention. So, Marge, we'll start with you, and again, welcome. Tell us a little bit about what you do and in the role that you play in the community.
Okay, I'm a volunteer for Berkshire Breast Health Systems and for Care Navigation, Women's Imaging Center, and I'm a member of the Berkshire Breast Health Team. And our mission is to educate women and men of the community about breast cancer awareness, what you can do to prevent it, what you can do to lessen your likelihood of getting it. We have lots of community programs. I'm out and about with other volunteers, signing up women for mammograms at Women's Imaging Center. And we just had a wonderful program in October about the genetics of breast cancer, and we had a geneticist from Dana-Farber come out and speak to us. It was a free program. All of our programs are free to the community. We've been funded by the American Cancer Society, by Susan G. Komen, and we really want to educate women of all ages, from starting as teenagers with our Check It Out program that we do at the high schools, to women in the jails, to women all over the community. So we reach out to every member of the community in lots of different ways, trying to get them to be at least aware that we have services, to get their annual mammograms, to do their own self-examination, which is so important to start when you're young, in your early 20s, so you know what's normal for you versus what is not normal, and then you bring that to the attention of your family care physician. And every year from the time you're 20 on, you should be having a clinical exam by your doctor, and from the time that you're 40 on, at age 40 you should have your baseline mammogram, and then you should have your mammogram every year after that, along with your clinical exam.
And how many hours do you work doing all this a week? Yeah, I mean, obviously, prevention is really important, and I think there's so many people that get confused on where to get accurate information.
Absolutely. I mean, healthy eating, as you said, exercise, don't smoke, don't drink a lot of alcohol. Those are the things that you do to prevent breast cancer, and staying that way lessens your likelihood. And early detection is the key, though.
Yeah, and I'm sure we can get more into a little bit of what's going on locally. And Ellen, I know you're part of the Look Good, Feel Better program, so you're here on the show to talk specifically on what's going on with that program. So welcome to the show.
Well,
Tell us a little bit about the program.
I appreciate that, Jim. And like Marge, we show up at all the same volunteer events like Relay for Life and like Making Strides Against Breast Cancer, which of course we just had in Pittsfield last month. But the Look Good, Feel Better program is especially important to me, partly because I lost my mother to cancer 12 years ago. And she was always very much about how she looked. That was important to her. And in her last days, she was in hospice in a hospital. So I had an opportunity to see not only my mother, who of course looked quite different at that point, but some of the other women who were in the hospital who just, I'm sure when they looked at themselves in the mirror, didn't look the same as they remembered themselves to be. And so I was a makeup artist at the time and thought I wanted to do something to to give back. And then I was at a Relay for Life and was introduced to the Look Good, Feel Better program. And the Look Good, Feel Better program, very simply, is a 2-hour free session for women who are going through any kind of cancer treatment to teach them how to deal with the non-medical side effects of cancer. So we teach them how to deal with changes in their skin, hair, and nails, loss of hair, and how to deal with that. You don't have to be a makeup diva, as I like to tell attendees. Many of the women who attend have never worn makeup. But when you are used to having eyebrows and you suddenly don't, it makes a big difference looking in the mirror. So that's just an obvious example. Right. And that's why, and I appreciate very much, as I'm sure Marge does, the opportunity to be on the show, because the greatest problem we have here in the Berkshires is women may be familiar or may not be familiar with this program. And we don't have the participation that we would love to see.
Absolutely.
You know, the program is available through Moments House and through Hillcrest Cancer Center here in Pittsfield, and it's also available at a Fairview Hospital for South County patients. And we're happy to go wherever we need to go. I did a program up at North Adams Regional Hospital when that was still available, but we just want as many people to know about this program as possible. It's just a wonderful thing.
No, it sounds like a wonderful program. I can only imagine what people go through when they have, you know, whatever stage of cancer, and, you know, if they can look good, feel better, to get out, get some exercise, eat a little bit better, and I think it gives them some better self-esteem. I think that goes a long way, rather than you know, being in your home and, you know, not getting out and getting the fresh air, and you know, your routine daily activities such as grocery shopping and, you know, maybe picking up the grandkids or children or you know, relatives. And so it sounds like a wonderful program. And remind us again, how long has that program been around?
The program has actually existed for the past 25 years. I did a little research before we came on today, and I was blown away. I knew it was around for a long time, but 25 years is pretty long. And during that time, now as they've celebrated their 25th anniversary, over 900,000 women have gone through the program just in the United States, and over 1.5 million throughout the world. So that's just to give you an idea. And here in the Berkshires, the program in Pittsfield has existed probably close to 20 of those 25 years.
Yes.
And we started the program out of Fairview in South County 5 years ago. And I can't believe it's been over 5 years. And hundreds of women have gone through the program in Pittsfield, and over 50 women have gone through it in South County, which is pretty good for, you know, for a small, relatively small area. And, you know, again, we appreciate the opportunity to talk it up.
Absolutely.
So.
And so walk me through how someone can get referred to your program. So whether I get diagnosed through my primary care specialist, do the patients automatically get that referral to your program?
Through the care navigation nurses, yes, they will actually walk you through all the services that are available here in Berkshire County through ACS and other programs, and obviously hook you up with Ellen or with the volunteers here in Pittsfield for the Look Good, Feel Better program. But the care navigation nurses under the auspices of Kathy Hatt and Kim Murdoch are wonderful about making sure that if you have a cancer diagnosis of any kind, that all the services that are available in Berkshire County, including Ride for Life, which gives you rides back and forth to your chemo treatments or things like that, are all available to you.
Yeah, you make a tough situation somewhat easier where all the services are there, rather than trying to figure out what's out there, who to call.
Yeah, exactly. I give a plug for Moments House, which has been wonderful. I was on the original board of directors for Moments House, and again, here's a service that we have just here in the Berkshires, in Pittsfield, for all of Berkshire County, for any services that you need if you have a cancer diagnosis for you and your family. So we have, you know, programs for your children, your grandchildren, anything that you might need. We can hook you up.
Absolutely. And you said a couple of interesting things before, Jim, just to touch on, and I know Marge wants to talk more about that too. The fact that breast cancer, as well as any other kind of cancer, is not just for women. And men also, unfortunately, can be stricken with breast cancer. And
do get breast cancer.
They do. And I just want to mention in passing that the Look Good, Feel Better program, although primarily it's women who take advantage of it, there is also a program for men, and there's also a program for teens. And although the program that is for women allows for people to be together in person, and it is a little bit about self-esteem and about sharing and support group, which is very important.
Very important.
The other programs, the men's program and the teen programs, are more website-based and literature-based, but we'd be happy to get information to anyone who'd like to participate.
Absolutely. We'll make sure we save some time at the end to make sure we plug our resources to know where everyone goes. And so I know, Marge, you know, we kind of touched quickly on, you know, prevention and, you know, what guidelines are out there. Can we maybe just quickly, you know, as we have plenty of time left on the show, just to quickly, you know, give our viewers, you know, what age do you normally check? You know, maybe talk about maybe self-checking, because you know, it's not always just relying on your primary care to go get your annual.
You have to be your advocate.
You have to self-check, and you know if something's wrong. So maybe quickly touch on that, you know, topic, and then we can get into Ellen, because she definitely has something here she wants to share with our viewers on the Look Good Feel Better program.
Such a great program. But as a woman, once you are a teenager, early 20s, you should start doing a monthly self-examination right after you had your menses. And it's important because you need to know what is normal for your body, so that if something doesn't feel right, then you know to go to your primary care physician and have a clinical breast exam. Also, from the age 20 on, it's recommended that you have an annual clinical exam by either your gynecologist or your primary care physician. This is just done in the office. It's very non-invasive. It doesn't hurt in any way, but it's important because they need to also be aware of what's normal for you versus what is not normal. From age 40 on, at age 40, you are recommended to have your baseline mammogram done. And we have a wonderful place to do it here with Women's Imaging. They're wonderful. They're absolutely wonderful. And we have great radiologists to read your films. And that provides the baseline, so we know what is normal for you. And then every year, it's recommended every year after that, you have another mammogram. If something abnormal shows up, they will immediately call you to come back in for more films, for an ultrasound, for whatever they need in order for them to figure out whether this is something they need to biopsy or not. If you do have to have a biopsy, they will walk you through that whole procedure. And from that point on, if you get a cancer diagnosis, Care Navigation will step in and will start, you know, sending you on your way to various programs and services here in Berkshire County. I do want to say that men do get breast cancer, and men should also be doing a self-examination. I do know several gentlemen who are survivors of breast cancer. Your likelihood of getting breast cancer as a man increases if you have a family history. Say your mother had breast cancer as a younger woman in her 40s, or your aunts or your grandmother. Then you need to be checked out. You need to check yourself out regularly, because if you do feel a lump, yes, men can have mammograms, and they do get mammograms. It needs to be checked out, because yes, men do have the same mammary tissue that women do. All mammals do.
And just to follow up on what Marge is saying, and you could speak to this, about the fact that what's normal for one person is different. It's not just feeling a lump. It could be, if I'm not mistaken, a density or, you know, thickness. So, you know, that's why it's so important to have that baseline.
And other symptoms of that there's something wrong would be if you have a rash or you have a swelling on the surface of your breast, if there are any changes in the nipple. And this is for men too, especially if there's a rash or a roughness and something is oozing from the nipple, then you need to be seen by a clinician immediately. So it's not always just a lump that you're going to feel. There are other changes that can occur on the surface of your skin, color changes, texture changes that are signs of breast cancer, and that's true for both men and women.
A great job explaining the important stuff. Are we doing a better, last question, we'll definitely
no, that's fine. This is important.
Are we doing a better job with all this education and prevention and outreach? Are we catching things better? And it's definitely, hopefully we're getting better at, you know, diagnosing and finding this stuff in the early stages to prevent, you know,
That's why
long-term.
mammograms are so important, because if you catch your breast cancer early, we have a better than 90% cure rate with breast cancer.
That's great.
And just
And
to,
that's early detection.
absolutely, and just to take that a step further, because I'm also a volunteer with the Cancer Action Network, which is the advocacy side of the American Cancer Society. And what's kept me going, among other things, is knowing, on the one hand, that 1 out of 2 men and 1 out of 3 women will face a cancer diagnosis during their lifetime.
Yes.
However, 20 years ago, 1 out of 3 people would survive a cancer diagnosis. Now, 20 years later, 2 out of 3 people survive. And hopefully someday, or I shouldn't say hopefully, for sure, someday 3 out of 3 people will survive. The point being, early diagnosis is so important, prevention is so important. And we do talk a little about this at the Look Good, Feel Better program as well. We talk about prevention, about healthy eating. The American Cancer Society has really taken on nutrition as an important component.
Very important.
So we're both, Marge and I are both on the same page about this. It's not, the Look Good, Feel Better program is important for the non-medical side effects of cancer, but it also is a way for women and men to learn how to take better care of themselves.
It's so important for that early diagnosis, because what we do today in terms of treatment is so different from what it was 30 or 40 years ago, when even saying the word cancer was kind of in a
Right.
whisper.
Right.
I know that when I first started doing medical research in cancer over 40 years ago, all of my patients passed away. I mean, and their care was horrific in terms of the side effects, and that we didn't have any way of helping them. Now, it's incredible how much cancer we can cure, and with minimal side effects. But being aware of healthy eating, exercise, limiting alcohol, and not smoking, honestly, so important, so important. The American Cancer Society has a new program out called Cancer Prevention Study 3, where we're looking at lifestyle and nutrition and things like that, and we're actually including a genetic component in it. Most breast cancer is not caused by genetics, and the older you get, the more likely you are to develop a cancer of any kind. And that's why it's so important to have that early detection and
For sure.
be educated about what you need to do and how you should go about doing it.
We need to stop blaming our parents and our past generations and look at what's going on environmentally.
Right.
And we are our own custodians of our own
Absolutely.
health. We need to make lifestyle changes.
Absolutely.
So Ellen, let's save some time to get into the Look Good, Feel Better program, and I know you brought something, maybe a quick demonstration on what's going on.
Okay, well, I just wanted, briefly, and thank you for the opportunity, Jim, I wanted people to see that every attendee who comes to the program gets a free bag like this of cosmetics, all of which have been donated. I mean, it's unbelievable. Lancome, Chanel, Avon, Clinique, you name it. And all the products, I should say, have been vetted by the American Cancer Society to be sure that they are, hypoallergenic and good for people. But the point is, you walk away with hundreds of dollars worth of cosmetics. And as I say, even if you're not a makeup diva, when you're faced with changes in your skin, hair, and nails, it's nice to have the opportunity, if you choose to use it, to make yourself look a little different. And you touched on something, and I am going to talk about my friend here. You touched on something, and I can't talk enough about this, the fact that being in the group doing the Look Good, Feel Better program, because we aim to have several women attend at the same time, is an opportunity for women to talk to each other about something they're going through that we, as facilitators of the session, can't really respond to the same way. But if you're sitting in the session and we have the women do their own makeup and we just help them, or do their own playing with some of the props that we're going to show you, but they have a chance to talk to each other about their treatments and about how they're feeling, and so it's a wonderful opportunity to be together. And so here, what I want to show people, my friend, well, Marge is going to help me with my friend there. Most people, men as well as women, will recognize these as being the pantyhose that they are, and I just wanted to demonstrate how easy it is. Let's just turn her this way. And this is one of the little tricks that we teach people. You put the pantyhose or something similar. We also do this with cotton T-shirts, by the way, because when you don't have hair, it's amazing how cold your head can become. And look at how simple it is to just tie on and make the little turban here on our friend, and you can see by the back that this is definitely pantyhose. We can make a little rosette, you can add a barrette, you can add a scarf, put a hat on top, and there you are. In a couple of seconds you have something that keeps your head warm and that's easy to deal with and that can be very fashionable, especially if you choose one of the kids' tights with various colors.
Right.
And when you're going through the cancer journey, and I'm sure Marge would agree, it's a wonderful opportunity to really do something a little different or try out different things. So maybe you were a redhead and then you've lost your hair and maybe you want to try a blonde wig, or maybe you want to try a dark brunette wig. And I can only tell you, and I've heard this not only from the women who've attended the sessions, but also from the buddies, and we allow them to bring someone, whether it's sometimes a husband, not usually because they can't sit through 2 hours of this, but generally it'll be a daughter or a sister or a mother or whoever. How important it was to the women who attended. They may have come a little hesitantly. They didn't really want to be there, and I always try to talk to them before they show up so they feel more comfortable about this. But just being in a 2-hour session, and we take before and after pictures just for them. This is very private. We never publicize the names. I want to be clear about that so no one knows who's attending. But the point is, we show them the pictures during the session before and after, and before there are very few smiles. And when they are finished and they look at themselves newly made up and with head coverings or wigs, there's a big smile. So anyway, my friend thanks you for that. Thank you, Marge.
It was wonderful. And one thing I caught in that conversation was about the social interaction with the group sessions.
Important.
I think that could be really important. With support, even after maybe the program has ended, they can continue on. There's this additional support network, and I think that is a secondary benefit of maybe going through a program like this, because we do a lot of chronic disease self-management programs. We know Matter of Balance. We work with BHS in the Get Cuff program. A lot of the stuff now is done in a group setting, and it's a really good environment, especially for seniors to get together that may have the social inclusion in their own home. And I think that's really got to be a wonderful benefit as well.
It is. I have been to several sessions of Look Good, Feel Better as the buddy, and in some cases I've actually had to talk my friend into going because they're embarrassed. They know they don't look the same. They certainly don't feel the same, and they don't really want to be talking about all these changes that have occurred in their bodies. But I tell them, you're going to feel so much better. Even if you just end up with a new moisturizer for your face, it's just going to make you feel so much better. And you're going to talk to women who are going through the same thing that you are, and you're going to find out you're not alone.
Absolutely.
You're definitely not alone.
That's the key. Absolutely. And that, I think, is more important than anything. It's what you were saying before. A lot of women who, because they're concerned about the way they look, don't want to venture out when they have lost their hair or when they feel that they look different than people would know them. And once they go to the program and they see other women going through this and they realize they can help themselves, whether it's cosmetically or just feeling the way they do, look more like they used to, they're more likely to go out. And those have been the stories, the ones I've heard after the fact, that have warmed my heart about women who have then gone out after participating in a session like this, where they wouldn't have before.
Absolutely. And I think we're just very fortunate that there are folks like you and many others, resources at the local, state, and federal level to really help those in need, because every day we're seeing cancer statistics still going strong, even with billions of dollars of research, and we need to do what we possibly can. So we have about a couple minutes left, and I know there's a lot of resources and probably some good contact information. I want to leave you both a good 2 minutes to kind of go through your programs one more time and contact information. We can maybe, if we have a couple minutes left over, we can kind of see if there's any leftover stuff, important stuff we want to talk about. So I'll leave it up to the both of you to talk about what.
Well, I just want to again stress that here in Berkshire County, we have a wonderful mammography center at Berkshire Breast Health Systems at the Women's Imaging Center, and we also have a fabulous care navigation system where women or men who have had a diagnosis of cancer of any kind will be set up with appointments and with nutritionists and with physical therapists and anybody that they might need to help them through their journey just beyond the actual physicians. We have physicians at the hospital now who deal with nutrition of cancer. You have to understand that cancer is not a single disease and that no two cancers are exactly alike and that there are many causes of cancer, not all genetics, not something you've inherited. It's more environmental exposure. And things, we are now becoming more aware of the relationship between cancer and other diseases like diabetes. This being Diabetes Awareness Month, there is a direct correlation between a 20 to 27% higher risk of having breast cancer if you have type 2 diabetes and you're postmenopausal. So
Right.
again, if you're eating healthy for your diabetes, it's going to help reduce your
Absolutely.
risk for cancer.
Right.
Real quick, Ellen, any
Okay.
contact information of your program?
Absolutely. Well, we have a program coming up at Fairview Hospital on the 25th of November, which is a Tuesday. It will be from 5 to 7 p.m. People are welcome to call me. My number here in the Berkshires is 413, of course, 258-2891. Or they can reach me at my email, which is havinghersay @gmail.com.
Great.
So I'm more than happy to direct people. If the program they need is in Pittsfield, then we'll direct them up there. Otherwise, thank you for the opportunity.
Wonderful. Marge, Ellen, it was so great for you to be on the show today. I think we got some really good information out there to our viewers. So thanks again, and
Thank
have a
you,
wonderful
Jim.
holiday.
Thank you, you
Thank
too.
you.
Thank you for watching another edition of the Be Well Berkshire show. I'm your host, Jim Willis. Check out our Be Well Berkshires website, www.bewellberkshires.org. Thank you.